watched any movie or TV show or given birth yourself and gone through the labor process and seen it in action, then you know that most of the time it is on somebody's back. The woman is laying on her bed, feet in the stirrups, somebody holding her legs, whatever it is, and she is pushing on her back. I'm here coming to you today to tell you that this is not the way that you have to give birth. In fact, it may not actually be the best position for you to give birth in. Okay, if I had known this prior to my first, there's a good chance I would have avoided 2 C-sections. But here we are. I didn't know any better, and so now I want to make sure that you do. Okay, different positions can have different effects on your pelvis. So for some, like myself, laying on my back actually compressed an already backside of my pelvis. It pushed my sacrum up and in the way, and it caused an inability for me to have a successful vaginal birth. For some, it might not have that same effect, and they may be able to birth on their back just fine. Okay. Now, for some, laying on your side and actually kind of squishing the pelvis from the side allows an opening in the back and can create a better space in the lower part of the pelvis. So if we squish up here and we squish the pelvis, from the top, the bottom will open a little bit nicer and the baby will have a lot more room. For some, using gravity and squatting or standing can be more beneficial. Okay, so it's all going to depend on your body and your pelvis positioning and what's comfortable and pain-free for you. But you don't have to do what they do in the movies. You don't have to labor on your back. Oftentimes, that's kind of the go-to because it is easier for the doctors and the nurses. But your birth is not about the doctors and the nurses. Your birth is about you and what's easier and more comfortable for you. So just know that you definitely do not have to labor on your back, and there are other options. Okay, if you're unsure of what might be the best option for you, have that conversation with your doctor, have an assessment done. I can do that. We can look at your body movement, your body position. We can take a look at how everything aligns, what feels good, what symptoms you may or may not be experiencing, and come up with a better plan. But just know that it is possible to avoid laboring on your back, and it might actually benefit you more if you avoid laboring on your back. So let me know if you have any questions, and I look forward to the next one.